Hello, and welcome back to Battlefield Medicine USA, our historical series exploring how medical science evolved during America's major conflicts. Today, I continue my conversation with Jen Williams, the founder of Kidney Contenders, as we examine the medical realities of the Persian Gulf War. In this segment, we focus on nephrology and how kidney-related care adapted to the harsh desert conditions of combat. We also address several common misunderstandings about Gulf War medical practices, including the challenges faced by combat medics and evacuation teams using medevac systems. Jen Williams will walk us through how battlefield medicine advanced during this period and how those lessons shaped modern renal care. Let's begin with her first question. Jen, can you explain the type of medical aid given and received during combat in the Persian Gulf War, especially how medical teams managed dehydration, heat exposure, and acute kidney injury, AKI, in desert conditions?
I was actually alive during the Persian Gulf War. And so I do have distinct memories what I saw on television, especially during, I believe it was 1991, when then President George H.W. Bush had primetime discussions to the nation about the status of the war um, in Kuwait. But I would say that combat medical aid and needs. During the Persian Gulf War, battlefield medicine advanced rapidly to meet some of the more unique challenges of desert combat. You had medical teams that faced extreme heat, sand exposure, obviously, dehydration, which often led to acute kidney injury. So you also experienced a lot of the acute kidney injury among troops operating in armored vehicles or under heavy gear. Combat medics were trained to deliver intravenous fluids, intravenous IV fluids and electrolyte replacements directly in the field, which of course was a major improvement over the Vietnam era protocols. Evacuation systems such as medvac helicopters and fixed wing aircraft. They shortened the time from injury to treatment, so that allowed stabilization within hours instead of days. Also, a lot of the field hospitals, they used portable dialysis units for soldiers that were suffering from renal failure. And that marked actually one of the first large scale use of mobile renal technology in combat. Medical personnel also coordinated with coalition partners to standardize triage and infection control procedures across multinational units. So, even though the war had a short duration compared to the other wars that we've looked at, the war's short duration just meant fewer prolonged injuries, but it actually highlighted the need for rapid response nephrology teams in future conflicts. So, overall, I would say that the Persian Gulf War demonstrated how modern logistics and medical innovation could deliver immediate, life saving care under extreme battlefield conditions.
What are some of the most common misunderstandings about medical practices during the Persian Gulf War, particularly regarding combat medics, evacuation systems like medevac, and the use of portable renal replacement therapy (RRT)?
I think if I had to, if I had to string everything together, I would say that many people misunderstand the medical realities of the Persian Gulf War because the conflict was short in comparison to the other wars. Also, it was heavily televised, and that creates the impression that few serious medical challenges existed. One misconception is that soldiers rarely face dehydration or heat related injuries, when in fact, extreme desert conditions caused frequent cases of acute kidney injury. Another misunderstanding is that combat medics had minimal involvement, yet they actually placed a critical role in delivering intravenous IV fluids and stabilizing electrolyte imbalances directly on the battlefield. And there are people that do assume the evacuation was effortless due to modern aircraft, but medevac teams still navigated sandstorms, heat distortion, and rapid fire engagements to reach injured troops. There are some people who believe that dialysis was unnecessary during the war, yet portable renal replacement therapy units were deployed for soldiers who were experiencing acute renal failure. So there's also a misconception that coalition medical teams operated independently, when in reality, multinational triage protocols were coordinated to ensure consistent care. And another misunderstanding is that the war's short duration meant fewer medical innovations, but the Gulf War actually accelerated advances in rapid response nephrology and mobile trauma care. So, overall, Persian Gulf actually revealed that even brief conflicts still demanded sophisticated, coordinated medical systems capable of addressing kidney related emergencies under extreme environmental conditions. So it may have been a shorter war, yes, but it was a war that did have tremendous impact.